Let's talk about our health and well-being. We are giving you important information with our amazing doctors. Honestly, my heart is doing with all the information I'm receiving right now. Before, even on the diabetes discussion, I wasn't aware the difference between diabetes type 1 and type 2 until we had that discussion. This is amazing. Honestly, you don't need to miss our show. We are doing it for everybody. They are just spending their time in order to add value to humankind. It's really amazing, and God will bless them with, they love you all, and that is why they are doing it. Information. Health is wealth, as they said. If you are healthy, you have everything. So sometimes it's good we spend on our money on what is necessary. You see people complaining that they don't have money to buy even paracetamol, good paracetamol to take care of themselves, but they will spend huge amount of money to buy Wivon, to buy clothes, to go for Ashebi, whereas you are dying. Check your health with your medical doctors. If you don't have money, at least prioritize. You need to prioritize your health. Where we come from, Nigeria, which we have poor medical infrastructure, we need to be very, very mindful of what we eat, and at times save that money from buying those expensive things that will not. They are all, vanity plus vanity, all vanity. So you need to take care of your health. That's my own. Ndowisho, that's what my grandmother used to say when she was alive. Ndowisho. Iga hospital, I have to say this one in Igbo. Iga hospital, honestly. Iwe okoge warakage ahoge iji okay. Iga negele chineke every day, because it's not easy. Like in Africa now, especially Nigeria, where we come from, our youths are dying of kidney issues. Sometimes, during the time of my grandmother and my grandfather, it was not like that. I don't know when I started hearing of kidney problem or kidney failure, but recently it is a common disease. What might be the cause?
I think to a large extent it's ignorance. People not being aware of what their health issues are. Okay. And I started off by saying that some of these things that lead to chronic kidney disease actually starts when you were born as a baby. Okay. And it is our practice back home. Any fever is malaria.
Yeah, it's true.
I don't understand how you can be treating malaria every day, fever, month, sometimes 2, 3 times in a month.
Exactly.
You're treating malaria.
Exactly.
No, malaria is not the only thing to give you fever. And like most people would have heard in the national media as well, so many people that actually, I know COVID is just topical, but so many people that had COVID, because they had temperature, they were being treated malaria. And I've had this experience. Doctors back home, please change your practice. Nobody has that monopoly of wisdom. You're not any second wiser than anybody in any way. Because I know there's this reluctance to answer direct questions. And I've had that experience with my own father, that I made a trip from here to go and see that doctor in Owerri. Cannot just each time he's had low blood pressure, which I eventually found out he just puts Bico in a drip and sends him. Whereas what he was doing, I cover his medications, I know what he takes. But then my mother, teacher of high repute, very serious woman, and I know what she can do. If she's going for any review, she'll go with the whole pack. Perhaps, did he understand the medication my mother brought along? I don't know. But the right there is. And then what happens? Doctor gave us, they take this. I supplied them, of course I'm a doctor and I believe of high repute as well. So I supply anything hypertension I know what he takes. because I've done his proper checks. I had his history in my palm. But for the acute events, because everything, you have a chronic problem, you have an acute event on top, which for most of us in this part of the world, you struggle with the acute. Because as reported, you don't really know. So you're relying on people back home to be your eyes.
Yeah.
But the people back home don't really want to listen. It's a case of, I know it all, and you cannot know it all. So please, please, I'm not going to use the word negligent, but please, can we listen to people? We don't have to put ourselves in a pedestal, because what tends to happen is your patients come to you. They would have, if you live around Lagos area, they would have started from Badagry by 4 a.m. to come to see you somewhere in Ujuelema, or whatever it is. Anybody living in that neck of the woods will tell you how long it takes. They make that journey. They're petrified of you. After all that effort, they cannot even tell you the issues. And you are rather dismissive of the parents as well. In practice, and if there's anything I've learned from this part of the world, is that you listen.
Yeah.
Embrace, not embracing in terms of, but please make that person feel that they're human. Listen to what they say, because there's something bothering them, and that's why they came. And if you listen, so most times you're able to allay the anxieties, if it's just anxiety driven. But when it comes to a medical issue, please pay attention to people, what they want to describe, because you have your local lingo that they use in describing symptoms, and you will understand it better than I would, because I'm sure I would not be able to understand it. But you have your lingo, but pay attention to them, and don't make them feel so afraid to even tell you anything. So back to your question about our youth having chronic problems. Let's say this stems up from what may have happened to them all those years ago. I don't know. It may have stemmed up from that. And if you had a lot of UTIs that led to pyelonephritis, and from pyelonephritis, there's scarring scar. That is pyelonephritis. If I say it is infection in the kidney itself, proper. Okay. So, and each infection, infected urine, what it does is that it will lead to some damage and death in some bits of the kidney.
All right.
Okay. And over time, those areas, death is death. There's no blood supply going to those areas, so there's scar formation. And then if you keep having that recurrent infection hitting there, and it's being treated as malaria, you wouldn't know.
Wow.
So you might get that your treatment for malaria. Yes, malaria is endemic in Africa, but that's not the only cause of temperature in Africa. There are other things. So for those youth, because for them, I wouldn't think that diabetes would be a reason so far, but it depends on the age you're talking about. Because for those youth, I believe it's something that started quite early in life, and then over time it has progressed to the kidney problems you're talking about. For those with type 2, it is well established and well said that if you have type 2 diabetes, you already have complications before you know you have type 2. Because type 2 is one of those things that come on insidiously to you. There are some people that may just end up having recurrent, we call it boils, so esuso, in some funny areas and stuff like that. Some of us will call it achiri, whatever it is. You're having all these recurrent infections manifested, but there's always some local way to explain it, and usually it is a spiritual attack. Some funny thing somewhere. It's not. Nobody is spiritually attacking you. Just go on your knees and call on your God. Nobody is attacking you. You have a medical issue, and that issue has to be addressed. So if you're having all these recurrent boils, or recurrent achiri, whatever you want to call it, please look more into it. For the doctors looking after you is to look into your blood sugar, because it might just be your type 2 case. You don't have to be massively fat to have type 2. Increasingly, you're having very thin type 2s, just like you're having obese type 1s. So all those things we know back in history, that this is the path it took. Things have changed. And we all know as well that kidneys nowadays are a lot bigger than their parents' generation.
Yeah.
Therefore, manifestation of illnesses is actually changing along those lines. My country, we don't keep stats as well. We rely on the West. And issues for the West is different to the way it manifests for us. But I can say that if I'm at work and I have somebody of certain group, I'm happy to have you at work because I know we cram the textbooks from page 1 to page last. We do that very well, very, very well, because that's all we have in Africa. Yes, and I was one of them because there's this massive book, Grey's Anatomy. In my medical student days, I read it from page 1 to page last.
Oh my God.
When I mean reading, not once, I read it. And people from my neck of the woods were very good. We're very good in those foundations, very good. But we need to apply it because we then get to that stage that we feel that I'm above all others. We're not. Pay attention. Sometimes I can understand because in discussions with colleagues back home as well, the government is not playing their part. So literally, you're earning your keep. But don't end that keep discourteously by making people pay for what they don't need, and the ones they need you don't provide. Because that's, I think sometimes financially we're driven down that path, and that leads to malpractice. I'm not going to blame anybody, but you can still please make that money, but let it be in a positive way that will benefit the patient, because it's a life-changing event.
I know.
If we get it wrong, it's either death sooner rather than later. So back to you again. I think it's most likely what happened in childhood. I don't think when you say youth, am I looking at 20 something? Is that what you call youth?
Yeah.
Or 18?
No,
20, 26, 27.
So 26, 27,
Like,
we should be.
like a case of this Ada Jesus that died recently in Nigeria. Her case is all over the social media. She died. For me, that was a case of kidney failure, but she was between 26 27 years old, and before she died, and they were talking about spiritual problem, pastor, and I don't know, and I am not a medical doctor. Seeing her, I felt that she had kidney issues because her face was swollen, legs, and at a stage she was I think she had stroke. She was not talking. So she was 26 years old, and I know of a beautiful girl from my own town that died of kidney failure too. No, she was between 26 27. So it is really sad.
Okay, she died from kidney failure or kidney infection.
I think kidney failure because at a stage they said that she needed dialysis. I don't know.
Needing dialysis is, I'm going to say it for my own sister. It's just crazy what happens back home. Because for the life of me, I couldn't even work out what the doctor was saying because I had the results with me. Even by their own lab standards, I had the reference ranges looking in front of me. And I was being told that the next line of treatment is dialysis. I say, dialysis for what?
And
Do you have a different result to this one I'm looking at?
Yeah.
He said no. I said, so what in these results that you have is suggesting kidney failure? So back home, people tend to automatically default. If there's even any abnormality, they just tell you it's kidney failure. And then, dialysis is 50,000. I don't know what it is now. That it's 50,000 a session. Is that really the case? The treatment of kidney failure, as Chinwe has talked about the stages, is not automatically dialysis. Dialysis is when you are in the extremes. That's when dialysis comes into play. But with my experience and what I've heard and seen back home, even if when you're in stage 2, they're suggesting dialysis.
Could it be then that the practitioner itself, because before you start talking about dialysis here, it's got to be coming from a renal specialist.
This one,
I'm
general
not a
doctor in the
renal
general
specialist.
hospital will tell you
So
that.
I would manage my patients comfortably, CKD3. I would manage comfortably as a GP. I'm a general practitioner, I'm not a specialist. Once a patient gets to stage 4, then I need my specialist colleague to take over that care and then plan what does this patient need, because they've got to consider other things. What is the cause of that kidney problem to start with? Is there anything that can be done about it? What medication are they taking? Can that be improved? So this is where you need your specialist involved. So I don't see how me, a general practitioner, will be seeing a patient and say you need dialysis. I don't know where.
Yeah, they do it instantly. Any doctor can tell you.
So
And
that's,
tell you, oh,
that's
go to
perhaps
Aguguo.
what needs to
If
change.
you're in what the answer is. I think my colleagues need to change their way of doing things.
Knowing when to refer on, knowing your level of competence, and then refer on
And
to a
everything
specialist.
is not dialysis. Okay? The young ones you are talking about, it's not just that it's hypertension, diabetes that can cause kidney failure. There are metabolic things that can cause kidney failure
Okay.
if we don't manage quite early. There are particular diseases that we inherit. I know such screening is not done in Nigeria. Usually it's sent to South Africa and it's going to cost you hundreds of thousands of naira. Most people will not pay for it. There are metabolic diseases that we inherit from our families, both arms, that can manifest as kidney disease. But our system is not that robust to look into that and give us a diagnosis so that we can start early in preventing those things. Our system is not there to support, which is really tragic. I am Nigerian trained, and I know in my days in training, all those things were happening. Sometimes you just want to weep, and if there's anything worse than blood coming out, that's what you want to do. Because I am a Nigerian trained doctor. I did my postgraduate here, and I can tell you the difference. I still prefer what happens back home. Then, not now. We had what it takes to put any society at par. We had it. But those in power, God bless your souls for what you did to the country, those in power messed up that country. Individuals are not helping themselves either, because it becomes a case of survival. So you have to survive. And if you're a doctor, how do you survive? You survive through your patients. Either you give the wrong treatment, and the poor patient says, Dr. Mose. And you dare not ask your doctors questions. Who are you that they shouldn't ask you a question? Who are you that you don't tell people, I'm giving you this medication. These are the side effects of the medication. There are medications you give that will damage the kidney. Who are you not to tell people? Most times, people don't even know what you're giving them. You're giving somebody gentamicin, for instance. Gent will make you deaf if you don't monitor the levels. It will knock your kidneys if you don't monitor the levels. Meanwhile, the poor patient dutifully turns up to have the antibiotics, unaware of the name of the antibiotic, totally unaware of the potential side effects. You, the doctor, doing it, you're not even monitoring the level. So they've come to treat A and live with C, D, E. That will impact on their lives.
Plus again, you see the other thing where again, people not being aware, not having awareness. You've been to a doctor, they've given you a medication in sachet, and then you've gone round to the chemist to purchase some more brufen.
Exactly.
To take on top of whatever it is that you're taking. So you start, because this ibuprofen, yes, it's a good medication if used, but there is a place for it. It's not something that you would take every single day, always. on top of the anti-malarial tablets that we're taking. These are all things that are toxic to the system, particularly the kidneys and the liver. Because you're taking all of these medications, they've got to be filtered through your system. It's your kidney, it's your liver that is having to deal with that daily attack from the several things we're taking. So it's really a combination of things. You've touched on it already. Some of the problems with the kidney, we are born with it. And of course you don't know that you're born that way. And then your lifestyle and what the other things that goes on in life means that that organ will then fail much earlier. That's probably the cases that you've mentioned, people dying very early on in life. So because if you're born with an abnormality, say the polycystic kidney disease, for example, you don't know you've got that thing, and you're leading your life as normal, and you're smoking, you're taking all of these repeated malarial tablets, and you're taking the repeated ibuprofen, you don't know you've developed hypertension, then that quickens the whole process. That injury to the kidney, the kidney is deformed already, and you don't know about it, and you're doing all of this, then you accelerate the process for that organ to fail. That's probably what's happened in the young ones that you mentioned, because otherwise it would be quite
it's
unusual
either
to die
something
that early.
inherited, something metabolic, something obstructive for the young ones. It's unlikely to be diabetes at that age.
At that stage,
The diabetes, hypertension will stem in later. But at that age, in the 20s,
there would have been a pre-existing.
There's a pre-existing that was not picked up.
Thank you, doctors, for your contributions. One of the listeners to your program, I just want to ask one question. Dr. Chinwe mentioned about some medication like ibuprofen. Is there any other medication that you think too much taking of those medications can affect the kidney? But I could remember in those days in Italy, they need to stop the usage of Aulin.
Which one?
Aulin. There's a medicine they call Aulin. It does everything. You can just under 2 seconds the headache stops.
Oh dear, that was very potent.
The medicine is so sweet that it's just like a powdered medicine. Just put it in the water. It cures everything. So there's certain point they have to stop it and then switch over to nimesulide. So do we think that there are some medicines that are well intake that we don't know, and we have to be careful when they give us all these things? Thank you.
A lot. There's this Bible that is used here, and I wish I have the opportunity to share it back home. It's called the BNFC, or BNF for adults. It contains all the medicines in this world. It will list there for you the side effects. It will list there for you the interactions, because you might just think you're taking Brufen, but you might also be taking another thing interacting with Brufen, complicating things for you. Not only does it tell you about the side effects and the interactions, it tells you the dosing, what range you can use. Okay? And I know doctors back home are like gods. BNF, I have on my phone. They provided it for me. Each time it's updated, you're given a paper copy. And the one on your phone is updated. So the advantage of it is that you will look at this patient's history. You have kidney disease. Can I use XYZ medication for this kidney disease? Because it will tell you, you can't use it for kidney disease. And it can interact with XYZ. So if you're contemplating giving that patient that, you don't do it. Because you know if you do it, you make their case worse. And I know that you don't have that in Nigeria. And let me be honest and say this to everybody's hearing. I have no qualms about it. I went to work through an international community in Lagos. And I was supposed to be writing, because prescribing, there's something you call prescribing in a country with limited resources. So if you want to get the maximum benefit, you give, because our people, once you go to that doctor, you will do what they tell you then. 2 weeks down the line, you will not. Okay? So once you're wanting to prescribe in a country with limited resources, you will look for what will hit hard at the biggest dose so that you achieve the benefit. And this is in my whole life, apart from seeing it in a textbook, I've never seen a case of rickets like I saw in Lagos. I have never. And what really stung me even the more, and I must admit I was just shedding tears.
Oh.
This was a 7-year-old was this tall. You know the whole story of rickets, frontal bossing, tibia libre, tibia like that, and very small. And mother was telling me that she wasn't allowed. They said they were doing breastfeeding exclusive. You're not allowed to do anything but to exclusively breastfeed. And the mother is as anemic as anemic can be. So what is the quality of her breast milk? But then you come up with these strategic punch words, but you don't pare it down to what affects the patients. And I saw this child, and the mother gave this story. When I mean rickets you read in the textbooks of the 1930s. I never knew you could have it in the 2000s.
Oh my God.
And I was just looking at what will I give this family, because I know family will chip in after that visit. Okay, but after that 2 weeks, 3 weeks, nobody wants to know, so that you get the desired effect. Off the top of my head, I could not remember the source dose of vitamin D. There's a lot of sunlight, because the sunlight, it's through the sunlight. You have a lot of it in Africa. The sunlight, thank God, but it has to be metabolized in your liver, gets to your kidney to become productive, as well as it has to be absorbed through the bowels to give you the desired effect. But this is a child, just looking at the child, was so grossly malnourished. Mother was malnourished. She had to, like it or not, she already had 2 babies and was still breastfeeding. Well, you begin to ask yourself, what quality she ended up. But that's by the by, that's a story for another day. But I couldn't remember the dose of the source dose. Purely because I'm used to DNF is looking for me there. So it's not as if I have it there. No, you don't know it. Let's not pretend. And this is to my colleagues. You don't know it. Don't pretend. Because we kind of feel it's beneath us to go through the pages. It is provided from me every time there's an update. It is in every clinical area. And it's done for a reason. And I understand it. Because that singular thing, and I was actually having trainees, that singular thing was an eye-opening moment for me. Because I couldn't remember the dose. And I walked all the way, going to local pharmacies. Went as far as there's a pharmacy opposite St. Nicholas in Lagos to ask. And it was just like they had one form of vitamin D and they just didn't understand what I was talking about. Since then, I just wish each and every center in Nigeria, Africa, wherever it is, you have it. We do not have a monopoly of wisdom. You don't know it.
So sometimes we are misled, but certainly because it is still true God that we got all those things. So we really need to be very careful, and our health, as we are our show, we are talking about health, because health is wealth. Take ownership of your health. It is important. If you're healthy, you don't need to worry about anything, because if you come to hospital and see people that are sick, my dear, that health, you will know that it is important. Every other thing is jara, as we say in Nigeria. Take ownership of your health, and that is why they are spending their time. They are not even looking for more. They are not asking for money. It's just giving that information to our people to make sure that they have that key information to take care of their health. So we move on with our kidney discussion.